I was saying, honestly, I would say it'd have to be my parents. They dressed up as one was a piece of jelly bread and the other was peanut butter bread.
Oh, how cute!
So
Yeah.
cute.
Very
Peanut
clever.
butter and jelly.
Yeah.
I love it.
Josh, did they just like jump together when they were out and about?
There is a video of them doing that. Yes.
That's awesome. That's great.
Yeah. I told them, I was like, you guys weren't like this when we were young.
Anyone else see any cute costumes this weekend?
Mariah, we always see a lot of cute costumes because my wife owns a daycare and preschool. So we have a Halloween parade of little ones and their families. And it's just every year I just marvel at the fact that how much these kids get into it.
So sweet.
I got the adventure of taking 7 seventh grade boys on the basketball team, TPing their teachers. And their teachers were all great sports. I will say that.
That's awesome.
And if any participants or any attendees have joined us right now, we're just kind of talking about what Halloween costumes that we've seen this weekend that were cute. So if you are an attendee and you want to chime in, please use the chat section and let us know if you made or saw any really cute Halloween costumes this past weekend. I had a coworker that sent me a picture of his daughter that was dressed up as a pancake with butter and syrup. I guess that's kind of her favorite thing to eat right now. So I thought that was fun.
That's cute.
And where I was hanging out with some friends this weekend, and we ended up doing a bonfire in the front driveway. It's a busy road, so we really didn't get any trick-or-treaters. So the only trick-or-treater was the Domino's Pizza delivery guy. And so I ran up to him with my basket of candy and said, "Will you please trick or treat? I have too much candy."
Take the candy. That's awesome. So you guys might get a laugh out of this. We could talk about it later. I started Christmas at my house last night.
Oh no!
Uh-oh.
I am one of those people.
Kathy.
All right, everyone. Well, welcome to the Connects FM Healthcare Multi-Site Facilities Town Hall today. I'm very excited for our first town hall and to be discussing some of the pain points of the healthcare industry. Just some housekeeping. We are open for question and answer. So there's a button on the bottom in the far right. You can click that and submit your questions to us in real time throughout the event, and we'll be happy to take those. So feel free to plug in at any point and ask us some questions. And I'm excited to announce our Healthcare Council Town Hall co-chairs, Mariah Kingen and Kathy David. Mariah.
Hello, everybody. Thank you so much for joining us. We'll kind of go through all of our topics today, give you guys some more information about who we are and what the town hall is about for healthcare. And you know, we will also have the opportunity to interact with attendees through the chat function. So please go ahead and make sure that you add the chat in. Some of you may have heard as we got started, we were chatting about the cute Halloween costumes that we saw. So you can always put that in the chat too if you saw any cute Halloween costumes this year. So hi, I'm Mariah Kingen. I am the portfolio director for DaVita Kidney Care. And I'm also a co-chair of this healthcare committee. I am also a board member and probably many other things in my tenure here with the Connects Association, but very excited about my transition almost 3 years ago now over to DaVita and into the healthcare community. It has been eye-opening and really wonderful as well. So we just wanted to really kind of talk to everybody about what is healthcare, why does Connect care about healthcare, and kind of where we're going from here. So I believe we've got a slide deck that we're going to share as well. And is that up, Shayna? Nope. I think she's on mute. Maybe Meg, if you can hear me. Okay, slide deck is coming up. Okay, so we're going to talk a little bit more about who we are. And first, I just kind of wanted to start, if we could advance to the mission statement. I think it's really important for the entire Connects community to understand that the healthcare committee is not separate or different from the broader Connects community. We're just a niche of the broader Connects community. And so we really want to make sure that we are in lockstep with the Connects mission and value statement broadly, and then narrow ourselves down a little bit more to just indicate that, you know, we are, it says here we're an elite network. I'm not sure how elite we are, but we definitely love what we do here. So we just want to be more consultative for the broader healthcare community from both the FM standpoint and the supplier standpoint. And so we as a council are going to seek direction from the Connect leadership, all of the different education events, resources and networking, and then facilitate the growth in this particular vertical. So that's kind of what our overall mission statement is. So it's very inclusive of the general Connect statement and just really focuses down into this, this niche, this different vertical that we have. Next slide, we'll talk a little bit more about who and what we are. So Joe on the team here found this great comment here from Gensler Research, and it states that people expect convenience, quality, and transparency when choosing how to spend time and money, and increasingly they seek the same from healthcare providers. Isn't that kind of ironic, right? We may not always think about healthcare providers as being more in this retail space or this Connect space, but there's kind of this term retail health that's emerging, and you know, we need to deliver as much quality, convenience, and care to our customers as any other multi-site does. So I would probably go back to Gensler and say, hey, let's put multi-site health instead of retail health, because that's kind of what we've branded at Connects as important, that it's multi-site versus just retail. But I think this really explains a lot about what is going on and brings to the surface about who we are and why we're here. We also talk a lot about, well, who is the multi-site versus the supplier partners for healthcare? You know, we've got dental, we've got medical, including, you know, kidney care for DaVita, optical, urgent care facilities, even things you might not think of like tattoo removal and pharmacy. So our vertical is a little bit more broad than maybe some people originally think of just healthcare. You know, we're not just hospitals, we're not just urgent care or just dental or just kidney care, but we want to be open and broad to what healthcare in this multi-site retail environment is and how we can help each other. And then we've got several supplier partners that are the same, right? Toilets are broken, we need a plumber. HVAC is down, we need an HVAC tech. You know, basic refrigeration and things like that are very similar. The nuances maybe of working within a healthcare environment could be different, and we need to make sure that our supplier partners understand that. But there's a lot of similarities there with what we do. And then there's some that are completely off the wall, at least for me, joining healthcare, biohazard and bio waste. didn't really have to deal with that before. Tube system maintenance, more specifically backup power system, additional water, specialized equipment like dialysis for me, and things like that. So it's definitely some part of the conversation that we want to continue to build with this entire community in mind. So that's kind of who we are, and ultimately our supplier partners are whatever we need, right? So we want to open this up and these conversations up to understand who needs what and how do we find each other within this broader community. So that's a little bit about kind of who we are as a council and why we got started. And now I'm going to pass it off to my co-chair, Kathy David, to talk a little bit about herself and then do an introduction as well.
Hi, everyone. Very excited to be here today. My name is Kathy David, and I am the co-chair of this council, along with Mariah. And I am the business development director at Core States Group. We are a national full service and vertically integrated architecture, engineering, construction, and energy company. I've been in the multi-site space for about 10 years now, and been a Connects member for a little bit over 3 years. So I'm very excited. Would love to introduce the rest of the amazing council, which is made up of multi-site healthcare leaders. We'll start off with our supplier partners. I'll pass it over to Joe Fairley. Joe, if you could please tell us about yourself and your role at your company.
Hi, everyone. Joe Fairley, Laser Facility Management. I am in business development, been doing this for 31 years. Very excited for this particular group because I feel that this is underserved. So we got together, and this is an awesome place for us to share best practices with regard to multi-site healthcare. So happy to be a part of the group.
Thanks, Joe. Next, Tony, will you please introduce yourself and your company?
Sure. Thanks, Kathy. So my name is Tony Pandolfo. I'm with NG Impact. We're an energy and sustainability company that operates globally. Healthcare is one of our largest vertical markets that we serve, along with hospitality and food service and a number of other ones. And my role is as a strategic sales director. And I can tell you it's very enjoyable because I get to meet a lot of new people all the time. So glad to be on this council. It's a great organization.
Thanks, Tony. Now, Bruce, will you please tell us about yourself and your role at your company?
Sure, Kathy, thanks. Hi, everybody. I'm Bruce Falke, Director of Sales with Commercial Fire. We're one of the oldest and largest fire life safety service companies, covered in the U.S., Canada, Puerto Rico. We do the design, installation, inspection, testing, repair, maintenance of all those critically essential fire protection equipment and systems for all the FM markets, including this exciting new market for Connects Healthcare. I've personally been in the FM industry for over 33 years, don't judge me. 25 of which have been in the fire life safety industry, with almost 19 years here in commercial fire, which also coincidentally coincides with my almost 19-year tenure with the Prism Connects Association, where I proudly served on multiple committees and was honored to also serve a couple of times on the board of directors.
Awesome. Thanks, Bruce. Next, we'll move on to our industry partners. Josh Brackett, will you please introduce yourself and your role within the committee and your company, please?
Yeah, absolutely. Thank you. Hey, Josh Brackett here. So I am newer to Connex, really excited to be on board. Been a member about a year now, and was asked to join the council. I work full-time for a hospital system, Banner Health. We have 32 hospitals and 400 clinics. And I serve as the Director of Regulatory Compliance for our facilities operations team. So I humbly like to say that I am a fire and code geek, and I'm about as geeky as they come. So I'm happy to serve on this council in that capacity. I also am ASHE faculty for the American Society of Healthcare Engineering and teach a lot of their training and education classes. around the nation for different chapters and organizations that want to be a part of it. And then also I have a company called Legacy FM where we develop custom training and education programs for healthcare facilities teams. So I live, eat, and breathe healthcare facilities and codes. That's about it.
Thanks, Josh. Next is Robert. Robert, will you please introduce yourself and your role at your company?
We're on mute, Robert. You'd think we'd have this down by now, but.
Okay, I sure thought I hit that button, but evidently not. Can you hear me now? Hello, folks. My name is Robert Blakey. The name of my company is FM College, which I started after I retired from Kaiser Permanente, working as a facility manager for many years in healthcare market as far as that goes. And, you know, my focus has been both nationally and internationally on providing quality FM education, not just for healthcare, but more general as well, and providing resources to people thinking about FM education as a lifetime learning activity instead of just something that we do in a few days or weeks to study for the industry. I'm a certified healthcare facility manager and have been involved with my local chapter as well as actually nationally here, as well as supporting other efforts both nationally and internationally in healthcare. So I'm happy to be here and looking forward to contributing to this committee as far as depth of knowledge and resources. Along with Josh here, I think that we bring some valuable experience and knowledge resources to the committee and to Connex in general. Thank you.
Thank you, Josh and Robert. We certainly value your expertise and your support to the council. Appreciate you. Next, we're going to move on to healthcare members. Mariah already introduced herself. So present from our SM or healthcare multi-site members on the call is Kenneth Jones. I'll pass it over to you, Kenneth.
Thanks, Kathy. So I'm Kenneth Jones. I'm the Director of Facilities here at Heartland Dental. We have 1,400 dental offices that we support in 38 states and nearly 1,800 dentists. I started this journey about 6 years ago here at Heartland Dental and learned a lot from just my relationships with Connex and then other FMs about healthcare and the the intricacies of serving dentists and their teams. So look forward to talking to you all.
Thanks, Kenneth. We also have a couple more healthcare multi-site members that are part of our council that cannot be here today. So wanted to highlight LB Johnson with Walmart Health and Wellness, Joseph Brockman with UCI Health, and Rachel Partridge with Concentra. Thank you. And I'll pass the baton over to Mariah to get us started on today's conversation.
All right, fantastic. And you know what? We've got another face on the call that we didn't have her introduce herself. Shana Thomas, do you want to introduce yourself as our fearless staff liaison?
Well, thank you. Hi, this is Shana. I'm the Vice President for Marketing, Communications, and Digital Experiences at Connex FM. And it's been a real pleasure to work with this council. It was one of our first, and they've done an incredible job. And I think you'll really get a lot out of today's presentation. So very excited, and great job, Mariah and Kathy and the entire council.
Awesome. Thank you very much. We've also got a host of some staff in the background. They were too shy to put their pictures up today, so we'll just have to say thank you for those in the background, making this all look so good for us today. So the main purpose of this town hall really is to kind of go over, obviously, who we are, what we're doing, and how we got started, but then also to really showcase a few of the pain points that we've been talking about. And we're also wanting to not only build up this community, but also build up the resources from within this community. And the first thing that probably happened is we started talking about pain points, which is probably pretty common for most of us to do. So talking through what our issues are, and then hopefully leading into some of the resources that we can put together. So what we did today, to not overwhelm everybody, because our list is a little bit longer than these 4, but we wanted to bring these 4 topics to mind and then have each of our panelists kind of talk through a little bit of their perspective on what these pain points mean to us. And then I believe Kathy will be running a poll after that. So our first pain point is infection control protocol. And I'm sure that's been a pain point for any multi-site or supplier, especially with COVID coming in. But Joe, why don't you take it away and talk a little bit more about your perceptions on infectious control protocols?
Thanks, Mariah. I think the important thing to remember about this discussion is it's a discussion. This is an open discussion that we've started to have around these pain points. And what do they mean? What do they mean to the suppliers? What do they mean to the FMs? What do they mean to the customers of those brands that we're servicing? That's the first piece. And the second piece is that the more participation we get from groups like this, the better the information is that we're going to be able to share across this platform. So today, infection control protocol, one of those pain points that we wanted to talk about, wrote some bullets down for us to kind of share and get your minds thinking about this. First is uniformity among all stakeholders. And by this, I really meant that this is a joint discussion. When we engage, when a supplier engages with a brand, our first need is to sit down and to understand, do we talk the same language? Do we use the same protocols? Are we using similar processes? Nothing can further the problem or the pain than to be working off of 2 scripts. So the most important piece is for us to really engage between the FMs and the suppliers and process protocol steps that make sense primarily for the brand and their customers. But everybody has to be working, kind of carrying the same flag. The next is, what do we do next with our protocols? Well, training is a huge aspect, and I love the fact that we have Josh's participation in this, because he said he's a geek, but he's actually a very talented training geek. So if you need advice on that side, certainly connect with Josh, because he's going to be able to give you a lot of tips. But some of the areas on infection control that we need to make sure that we're training, first on standard precautions. Most importantly, everyone needs to have these in writing. Nothing is going to be well done in our training process unless we have those in writing. And guess what? If we have them in writing, then we're going to be able to share them across this platform. And everyone's going to have to, or going to be the beneficiary of better written training materials. These are things just like gloves and how we deal with, the processes and steps that we come in contact with when regard to a healthcare facility. The next step is disinfection. Disinfection is now somewhat new as far as process control. We thought we had disinfection down, and then 2020 hit, and disinfection quickly became something completely different than anything that we had gone and experienced before. And now we're finding out yet again that it's a little bit different. That disinfection on an airborne virus, for example, is going to mean different things than all of the contact surface applications we had to deal with in the past. The next, on general housekeeping duties, that's where that disinfection, kind of the rubber hits the road. These are our focus areas, and touch point cleaning, and how do we address the different rooms involved, whether they're waiting rooms or restrooms or exam rooms and so on. But it's just sharing all of that information and how we train the staff to act in those areas. Medical waste was another area. Normally, especially for vendors like myself, we usually got involved with medical waste only from touching it from the point of origin to a staging area. Now we have to make sure that we really go further and train every part of the process. So while they maybe a vendor might not touch part of the process, they need to know what's going on, because that kind of gives them the confidence that things are being done well in that facility. And then finally, reporting. Basically, what I say on reporting is that report all. Everything is a reportable item, at least to your contacts within the facility. It's better to share the information and share too much information than not be sharing it in the first place. But those represent kind of 5 areas of training that we've begun these discussions on. And again, to have uniformity, we have to have these discussions among all of our vendors and all of the brands that we support, and have a protocol that's consistent. So thanks, Mariah. On to the next pain point.
Awesome, Joe. Thank you very much for talking us through that. I know that was pretty high level, and I'm sure each of you attendees can probably think of 20 more bullet points, and please share them with us. So put it in the chat, have conversations with us later. I think Joe put his information in the chat already to contact. We're happy to continue the conversation. But now we're going to move over to our second pain point, and Tony has been gracious enough to volunteer to chat a little bit more about compliance.
Thanks, Mariah. And Joe, what a great segue into compliance, as you talked about all those critical protocols that everybody needs to take care of. And I must get this compliance topic a lot, because I'm the Architectural Control Committee Chairman in our HOA. And if any of you live in a neighborhood with an HOA, you know that you wind up hating the ACC chairman. So I'll try not to be too demanding in this discussion. But one of the first things that we all have to look at is state and federal regulations, and those are, I'm not going to dwell on those because they're obvious, but they do touch all of the different functions, certainly that we have to deal with in the healthcare area. One of the things Joe mentioned was medical waste. If you look at the waste stream in a facility, it's not just medical waste or traditional waste, but there's hazardous waste and e-waste. There are a number of states, California being the poster child for this, that are very, very stringent about not commingling those waste products, and the fines can be pretty substantial. There are a couple of other states like New Jersey and Washington and other progressive states that have those regulations on the books. They're not very stringent about enforcing them at this point, but it's something to be on the lookout for, because it's probably going to happen as we move downstream. The COVID-19 issue has introduced a lot of protocols around compliance issues. And one of the schools of thought in the industry is that it's not always about the protocols themselves, but it ties into company values and company culture. These things become not just rules and procedures, but they reflect how your company actually does business. And so people have found that by motivating employees to do the right thing in difficult circumstances can result in getting those COVID-19 protocols under control around these compliance issues. And the last thing I'll leave you with, which I thought was very interesting, is that compliance can be thought of as a business process. So as a process, it can be measured, it can be managed, and most importantly, it can be improved. And that actually came from the Department of Justice in 2020. So I think as you look at all these things around the topic of compliance, the things to be aware of, things to make sure that we pay attention to, and certainly these are areas that will help us run our businesses better. So thanks for listening. If you've got some other ideas around compliance that we ought to be talking through on our team, please put them in the chat. And thank you all for joining today. And Mariah, I'll turn it back to you.
Okay, wonderful. Yeah, I think we all probably know that compliance is top of mind, especially in healthcare. I know for me, that's probably one of the most eye-opening things moving from traditional multi-site over to healthcare is the different compliance issues. And, you know, for me, Department of Health, that's always a pain point. Who do you notify? How do you notify them? As well as some of the other compliance. And then two, with the COVID-19 protocols changing and being state by state, you know, I think, Tony, to your point, and Joe, to your point, you know, communication is key here. How are we communicating with each other, and then all of our internal teammates to make sure that we are not only in compliance but talking about compliance and what we need to do. So really appreciate that perspective, Tony. That was fantastic. Great. Well, our third topic to review, Ken is going to share maintaining relationships with doctors and providers. Take it away.
Thanks, Mariah. So this is one of the topics that I'm most passionate about because half of my job is maintaining those relationships with our doctors and teams out in the field. We start with the why, and we work with our suppliers and our internal teams. Most of us have a vision and mission at our company, and for healthcare, it always is to support the doctor or the providers at that office. So like at Heartland Dental, our mission is to support dentists and their teams as they deliver the highest quality dental care. So we're there to support them. So we work with our suppliers and they understand our vision and mission. Our team understands it so that they know when they go into that office that that's why they're there. Without dentists, we don't have jobs. So again, we're there to support them. Second, those dentists are the leaders of the practice. So they lead the practice. So we work with suppliers to make sure they understand that the dentists or doctors or providers, they lead the practice. So they have questions, they have recommendations, they have those type of things. Just like us, we need to hear the dentists and the doctors and how they need to be supported, because we are there to support them. Minimizing disruptions to patient care. So again, our dentists, our doctors are in there working on people's mouth. They have sharp tools. The last thing they want to hear is a hammer pecking in a mechanical room or someone disrupting their patient care. So we have to be very careful about when we schedule. Our suppliers are very aware of working around schedules and things like that, where they do work. So again, if they're on the roof or they're here and there. Communications with the on-site staff. So managers, doctors, providers in that office. It's important to over communicate in these situations. Where are you going to be as a vendor or a supplier? What are you going to be doing? What kind of sounds are going to come? Is there going to be any dust? So it's just really communicating and realizing that there's patient care going on. So again, just a high level of communication. Again, we also have HIPAA requirements. So there are areas that suppliers can't be in, and there's area information that they can't see. So again, HIPAA is a large thing for us too. So communicating again with the on-site staff, just letting them know where you're going to be, what you're going to be doing, and of course, always checking out so they know, hey, we can lock up for the day. The last thing is matching urgency. So this is one thing I share with my team and I share with our suppliers. You have to match the urgency. Sometimes we get caught up in, hey, I have to be there within 8 hours because it's this type of issue, or I have to be there within 24 hours. It really is communicating with that office. What is their urgency? So some things as we may, as facility managers and suppliers, may not see as an emergency, they do. A wet ceiling tile may not seem like an emergency, but if someone's in a dental chair looking up at the ceiling all day, again, we want to fix that ceiling tile. Also, working after hours or working on hours, we're not seeing patients. So most of us have hours that we don't see patients. So we'll try to schedule there. So going back to match the urgency, someone may have a water leak, but they may say, hey, I really don't want you to come out for about 3 days because we're not seeing patients. But again, I share this with my team. Matching urgency is one of the most important things we can do. So if it's an emergency to that office manager or that dentist, we match that urgency. If it's not that big a deal to them, we match that urgency and schedule that later. So again, for us and our suppliers, success really is supporting the doctors and their teams. It's a win-win for both of us. So again, look forward to your questions on this. And Mariah, I'll kick it back to you.
Awesome. Thanks so much. Can you maybe expand just a little bit more on matching the urgency? I know, do you ever come into a situation where maybe local urgency isn't as urgent as it should be? Like on the, kind of on a flip side, sometimes like, we got this, it's fine. To your point, don't send somebody out for 3 days. Does that make you as like a facility manager just like freak out a little in your mind?
Yeah, it does make me a little bit, but again, it really is understanding and setting up countermeasures so we don't have more damage. But there are situations where it is a life safety issue and someone may say, hey, we can take care of this later. And again, we match that urgency, but we also coach. We say, hey, here's why. Here's the why we need to get that vendor in after hours, or we need to be there within 4 hours. We think about water damages. We don't want to wait 3-4 days. So let's get someone out there during the off hours. We'll start the drying process and we'll work with you to make sure you can see patients. So yeah, we do a lot of coaching. And if they don't have the urgency, we do coach some of that urgency.
Perfect. Thanks for expanding on that. Yeah, I know that's one of the things that kind of gives me a little bit of pause. Is sometimes the urgency is like, get out here in 20 minutes. And you're like, why? And then there's other times where the local teammates say, oh, we're fine, especially in a flood situation. You're like, not really. Let's help educate. Perfect. Thank you so much for expanding on that. So our fourth pain point topic to talk about today, we're going to pass over to Bruce, and he's going to share a little bit more about maintaining positive patient experience. And I'm excited about you to talk here too, Bruce, because we talked as a group about, maybe an FM should take this one. However, maintaining positive patient experience goes beyond just the FM team directly. It really goes to our direct supplier partners. So Bruce, talk a little bit more about how you help maintain positive patient experience for us.
Sure, Mariah, that's great. It's funny because, Joe, Tony, Ken and I, it's kind of all tying it all together now because, you sit back and think as a supplier, well, how am I going to impact a positive patient experience? But it's all in how we manage the program that actually does warrant a good positive patient experience overall. And let's face it, that's the success of a true program. So the way I've looked at it, and I wrote a few highlights down, is you begin by truly partnering. And that is the company itself and the suppliers. So the FMs and the suppliers, we've seen an evolution over the years. And I think it's a maturity level where they're truly partnering with one another and reaping the benefits of such partnership programs. And I think to get it all started, when you design a program corporately, we always think of the KPIs and the SLOs, which is great. But to get it started, you need to discuss and mutually agree upon all of these key performance indicators, all the service levels, to best manage your new partnership program, along with a customary program management oversight kind of things that you need, such as W-9, certificate of insurance, billing procedures, contacts, and so forth. But I think it really kind of gets more into mutually agreeing upon corporately, and of course it's going to channel downward toward the field and the suppliers themselves being on site. But mutually agree upon the process and protocol. And I listed D&Es and NTEs as a great example, because to that end, if you outline and determine all of these, appropriate work order process protocol, from scheduling the PMs and emergency dispatch to the D&E NT amounts in order to handle any kind of, found on PM work, ultimately it's going to eliminate a return trip and additional disruption of patient care. So again, if you establish those up front, that is warranting a better care and overall awareness of the patients themselves. The other thing I think, obtain specific site needs. So each company is going to be a little bit different. So the FMs need to ensure, corporately, obviously, their supplier partners should fully understand preferred service times, points of entry, any kind of specialized security requirements. And this will obviously eliminate some of the negative impact on patient care as long as they're detailed. And of course, getting to Ken's point, appropriate scheduling, whether it's corporately, because I know companies are going to be a little bit different, or whether it's scheduling with the site doctor or management determination of what the most appropriate schedule is. I mean, this goes without saying. Scheduling of services must be detailed before the rollout of any program, because this will limit the interruption of any kind of patient care. So whether they're scheduled corporately or scheduled by the site doctor or management, detailed instructions should be, in our opinion, printed like on the work orders, and the service partners must do their utmost to adhere to those scheduling instructions. And so, as I also mentioned about detailing the work order instructions, any and all program or site-specific instructions such as IVR, PPE requirements, they touched on like the COVID health protocol, sign-in logs, all of that, that also must be listed and adhered to by the service partners as well. And again, we can't communication, as Ken said, we can't stress this enough. Everything that I've mentioned previously can be tossed out the window if we don't maintain a continuous line of communication with the FM's designated points of contact, especially if the service partner is running late or must, maybe reschedule services due to some kind of unforeseen circumstances. But the bottom line, and finally, guys, sensitivity. Be aware of patients. Our service partners must be so sensitive to the doctors, the on-site management, and especially their patients. I mean, guys, keep in mind, it's not like a retail or any kind of other environment. These patients may be experiencing pain or anxiety during their visits, and we don't need to exacerbate that or add to that. So again, being very aware of patients' sensitivity and the needs, it can't be said enough.
Bruce, those are great points, and especially that sensitivity to the patients. I used to joke when I was in my more standard, retail multi-site jobs that I would tell people, come on, guys, this isn't a heart in a box, right? Like, it's carpet, it's it's a toilet, it's not the end of the world, and I can't say that anymore, right? I've got kidneys in boxes, not hearts, but it truly a sensitivity to those patients as well. There is a question in the chat that got brought up, but before we get there, Josh, I'm going to throw you on the spotlight for just a second. Thank you so much for posting in the chat that if anyone has any codes or regulatory compliance questions, that they can reach out to you. So if you guys haven't seen that in the chat, definitely get Josh's information. But Josh, what's maybe the biggest question that you've had to answer, maybe re-answer this year? I know it's a big one.
Oh boy. There has been a lot of questions really around accrediting organization surveys and how those are being handled. I mean, I've had so far this year 7 joint commission surveys at various hospitals, and just really the differences tied to how COVID has impacted not only those surveys, but our reimbursement from Medicare and Medicaid. So there's been a lot associated with that, because there was a significant amount of time where we weren't, as an industry, allowing vendors or manufacturers into our facilities, right? And I know we've all experienced that. So, and when you can't do that, then how can you keep your systems compliant, right? So there were a lot of questions tied to the waivers, the CMS 1135 waiver, how that applied, what you had to have, how you have to document that if you took that exception. So that's one of the biggest ones for sure.
Awesome. Well, thank you. Didn't mean to throw you on the spot there, but
no,
kind of what we do.
It's fine.
Fantastic. And then, Kathy, before I toss it back to you, I think there was a question here in the chat, question from the audience. Expanding predictive analytics of mechanical systems will require some CapEx investment. In the healthcare industry, where do you feel the cost should primarily fall? And Robert, I think you kind of mentioned a few things in the chat here. Will you kind of summarize your chat and then maybe expand on that a little bit?
I'd be happy to. Actually, I've seen monitoring-based commissioning systems, which are kind of on top of our building automation system, being invested in at very minimal capex cost, and providing a better understanding of the cause and effect of different issues we might have in systems, and being able to catch them early on. And my suggestion was that this could be a very cost-effective approach to minimize capex expenditure, and then allow us to focus on predictive tools that we would choose to add on specific areas that might be pain points, instead of taking a very large and deep approach to predictive tools, which can be difficult to manage in a multi-site environment, whereas a monitoring-based commissioning an electronic system with algorithms could provide uniformity across many different sites as an application. So those were some of my thoughts relative to it. First, try to minimize the cost with better utilization of the data you already have in the systems.
Yeah, that's fantastic. I know from my perspective too, one of the things I've had some success with is, my internal facilities department has a budget, and then our operational partners also have a budget. And in some cases where the capital investment cost will decrease an operational expense, I've been able to kind of chat with our local finance teams and come up with solutions that maybe local operations can pay for it, because they'll see the more immediate return and go from there. So I think that is a really good point, where sometimes you can, play around with who pays for what within your company, based off of who maybe is going to realize some of those savings afterwards. So I would just say, don't be afraid to ask for someone else to pay for something that could be a more traditional facilities related expense under different times. So great question from the group. And I think we want to move forward. Kathy, I'm going to pass it back over to you to kind of set up a little bit more interaction. So all of the attendees who are currently multitasking, taking calls, answering emails, you can put all that down. Time to refocus again and help us out with a poll here. Kathy, take it away.
Thanks, Mariah. Well, thanks, team. That was a great conversation today with some topics that are important in the multi-site healthcare space. So we discussed some pain points and trends that we've seen. We're going to open up a poll in our chat, and we're asking our audience to please rate and prioritize the pain points that you and your teams are currently experiencing. So again, if you could please open up your chat box, click on the link to participate. And I think that Meg's going to throw the poll results live going up on the screen. And in short, your feedback or your prioritization of these issues affecting the multi-site facility space is important to us as a council and as an association. We want to better serve you and create more content and resources such as white papers to better serve our healthcare FMs and the healthcare community.
Thanks, Kathy. And I know the poll jumped up in front of my screen for me, and I also answered the poll. So I know most of everyone on the call knows what my pain points are, but thank you for that, and definitely encourage people to fill out the poll. And I think while we're waiting for people to finish filling out the poll, we'll have some information that'll come back. Again, this will really help us move our committee forward with additional conversations around these pain point topics. Shanna or Meg, I believe that we wanted to kind of show people how to get a little bit more involved with us by showcasing the Connects FM website, as well as the community and the chat functions. Not everyone may be aware that we have our own little independent co-page here.
Yep, and if you go to connectsfm.com, And under Get Involved, it says Healthcare Community. And this lists out all of our resources, and this is being built, again, much more into 2022 as well, but you can get quick links to all of the resources available on Connects FM, as well as a quick link into our community. Our community is a members only community right now, but you can go in there, and we have a very active conversation and it's getting busier and busier as we're approaching into November. We may take a little bit of a holiday lull, but for instance, you can post any kind of issues or challenges or just solutions that you're searching for. This goes specifically to all of our healthcare Connects FM multi-site facilities professionals. And I mean, this is a great crowdsource tool, a great collaborative tool. It's a good safe place where if you're just really looking to bounce things off the experts in your industry, just to get some feedback on. We have, as a council, we are constantly monitoring this as well. And if we don't have answers, we can definitely reach out to our network to find those answers for you. So this is an incredible tool that we really highly encourage you to take advantage of. Sometimes we can get a little bogged down and forget that there's a network of people out there to support us.
Yes, and I know Joe has been an active content poster on all the socials. I am not good on the socials. So Joe, do you want to talk a little bit about the chat feature and kind of where we're hoping to go with our more broad community platform?
Yes, one of the highlights I wanted to mention is that we are a growing community. And we actually need everyone on this call. We need everyone to find a way somehow to participate, even if it's just a little mention from these chats that come across. What we're trying to do in the chats is to take some of the pain points that have already been mentioned and come up with either a resource or an explanation or to define it and start a conversation. We're not trying to levy, hey, this is the answer to everything. What we're trying to do is to start the conversation so that the greater group can get involved. And that's where we need everybody on the call. And that's what I wanted to bring up by raising my hand here, is that we need more participants. We need more individuals from the multi-site side. So if you know of others that would be great participants in our community, please ask them to join. They don't have to specifically be one of those healthcare avenues mentioned. They could just have an interest in this space and give us some input. So that's the strength of our community, is going to be in our numbers and how aggressively we put out information and how the engagement, I would say, of our conversation starts to increase. So thank you all so far, because it's been great, but we certainly would like to see everyone participating, because that's where the value is going to come.
Fantastic. And I know on my screen, I can see the survey results of the poll. Hopefully everyone else can as well, if you've got that up. Interestingly, nobody on the call seems to care about ensuring appropriate backup power systems are available. So that's kind of an interesting call out. However, Josh, your inbox may be blowing up because 50% of people have compliance issues. So get ready, buddy. You might be really sorry that you added your email in there.
Oh boy, let's do it.
Oh, very good. No, I would also echo what Joe was saying there too, and I'm sure Kathy does as well. You know, having the survey, understanding where we're going from an internal conversation and how do we bring that forward to the rest of the community is really important, so that we understand what the greater community needs, and then how we can focus our attention as a council too. So, definitely look forward to some future chats, look forward to potentially future town halls. And we really want to be able to share what's important to this group and keep the conversation flowing and keep it alive. Kathy, any other last minute items before we wrap up?
Just wanted to thank everyone today for joining our first Healthcare Council Town Hall. You'll be seeing more content from the council for our healthcare community in the coming months. And, You can see some of our faces on the Daily Grind that airs daily at 2 p.m. Central. So stay tuned for that. And yeah, just thanks everyone.
Hey, Mariah, I know, and maybe Shayna, you can kind of highlight this as well, but the Connects National 2022 in April out in Long Beach. I think we have some conversation around maybe doing something there as well as part of the council and welcoming people and some kind of event. It's really not determined yet, but it'd be a great venue to have everyone come out and get to meet everyone personally and engage in the conversation like Joe said. I think that'd be dynamic.
Fantastic plug. Yes, you can go to national.connectsfm.com. It's April 25th through the 27th in Long Beach, California. And we're looking forward to it. We're getting our schedule together. So if you go to national.connectsfm.com, you can see the schedule as it comes alive there. And registration will be opening about the second week of January, around January 11th. So we're very excited to be back in person. So ready. Yes.
Absolutely. Fantastic. Well, I think that wraps up our town hall. Thank you again for all the attendees. I guess we were also live on YouTube. So definitely appreciate everybody's interest in this new community and council, and look forward to hearing more from our attendees in our different areas, including the chat on the website. Thanks all for attending. We appreciate it.